as I decided I wanted to become a physician, always I never had that problem of reconciling science and faith that so many people struggle with. Because for me, it seemed obvious that science came from the Creator.
Welcome, everybody, to Pivot Point of View. It's Becky Pearson, and today I am joined with Dr. Lee Warren. I'm super excited to visit with him because he is a neurosurgeon not far from us in North Platte, Nebraska. I was very amazed when I heard about you, and somebody said, well, check out this book that this neurosurgeon wrote. And so I had to get the book and read that. And so I really wanted to have a conversation with you because I have started listening to your podcast as well. And I'll let you dive into that a little bit today. And so tell us your story. Like, where'd you grow up? How did you get into neurosurgery, and what took you down the path you went?
Great. Well, thanks for having me on today, Becky. I appreciate it. We sort of feel like we've come full circle because I grew up in a town in Oklahoma called Broken Bow.
Oh,
It's 2,000 people, and it was founded by people from Broken Bow, Nebraska, in the early 1900s. And so all my life, I've known that there was a Broken Bow, Nebraska, but I never thought I'd live so close to it. So, my wife Lisa and I moved to North Platte from Casper, Wyoming, about 9 months ago. We were in Wyoming for 5 years, and previously had been in Alabama before that. Were in private practice in Alabama, and then after the Affordable Care Act, commonly known as Obamacare, passed, really became very expensive and almost impossible to be in solo practice. Just significantly raised the overhead, and so we decided to look for employed practice opportunities, and had always loved the West, so we ended up in Wyoming, and that was really cool. But then in the late part of 2019, there was an acquisition by a big hospital corporation of that hospital, and it just kind of the big corporate medicine thing was not what we were interested in. And around the same time, the recruiter who had brought me to Wyoming in the first place reached out and said, "Hey, they're trying to start a neurosurgery program from the ground up in this place called North Platte," which I'd never heard of. But, so we decided to take a look, and just kind of prayerfully thought we'd check it out. And we're looking at jobs all over the country, and we came to North Platte, and the first question we had for the hospital was, why do you think you need a neurosurgery program here? And they told us lots of stories about how they had to fly people out of here. They'd never had a brain surgeon here at all, and there'd never been helicopters coming this direction, an area that encompasses square mileage about the same size of Pennsylvania, that's never had a neurosurgeon. And so we were kind of intrigued by the idea of starting something that would really benefit a lot of people. And so we started looking around the community a little bit, and the first three people we met that didn't work in the hospital had family members that were flown out of this hospital for neurosurgery. It was like amazing. Just the Lord just showed us over and over a brain tumor, a hydrocephalus patient, a head injury. And so then we started looking for places that we might potentially live if we decided to come here. And the first piece of land that we looked at that we ultimately bought was owned by two people whose son had died of a glioblastoma.
oh my gosh.
And so we were like, we're supposed to be here. Like, this is obvious that we're supposed to be in this place. And so it's just been a great experience. And I'm very blessed and fortunate to have my PA and her family, and our OR supply guy and his family, all decided to come with us. And then shortly after we came, our billing and insurance lady and her family decided to come. So we brought 12 people with us to North Platte. We increased the population by like 1% of the city. So we brought our whole team with us basically, and it's been a great. And Lisa's working in the hospital as well as a consultant, establishing and helping to run the business of neurosurgery as she did in our private practice. So we really are getting to work together again, and with all of our same people that we're comfortable with, and it's been really a beautiful thing. And so for the first time, LifeLight's bringing patients to Great Plains Health instead of flying them away for neurosurgery. So that's cool. I grew up in a Christian home in Oklahoma, and was raised to have a deep faith in the Lord, and so as I decided I wanted to become a physician, always, I never had that problem of reconciling science and faith that so many people struggle with. Because for me, it seemed obvious that science came from the creator. And so as I got into neuroscience and the nervous system, the thing that really did it for me was seeing the detail and organization of the nervous system, no matter how deeply we look into it. So that as we get better imaging and better technology to look deeper into the cells and deeper into the anatomy, we never stop finding more complexity. It just gets more and more intricate the deeper you look, which to me is the opposite of what we see in nature, right? The longer you leave nature unattended, the more chaotic things get. But here we have in the nervous system things getting more and more organized, and so I just that emphasized to me the reality of faith as a designed entity, the nervous system as a designed entity, and I can have great faith in that. So that's kind of the nutshell of my story. I was also in the military, received a scholarship for med school from the Air Force, and ended up in Iraq in a combat hospital in 2004 and five, which my first book was about that experience and some of the PTSD and some of the things I dealt with in going through all of that. So I actually started writing as a result of kind of learning how to unpack some of those things that I saw in the war, and um, that's been a whole another sort of second career. All of that, though, really writing and blogging and podcasting really started full time for me after we lost a son in 2013, and that kind of learning how to be one of those people going through hard things instead of just trying to help those people going through hard things is really what started me on this path of podcasting and connecting with people like you.
Well, I think I mean, I give you so much credit for, getting out there and sharing your experience with others because, I mean, obviously, it would be. I have no idea what you went through, and I hope I never do. And I I can't imagine. And I think, probably when people go through that, they feel very alone
Yeah.
not many people can relate to that. So I think you're reaching out and sharing your story probably has a lot of healing benefits for you as well
Yeah.
as helping others for sure.
Yeah, that's right. And when you talk about gifts that you've been given, by the Lord, or however you view that in your worldview, from a Christian worldview, there's all this information in the New Testament how Jesus expects us to use the gifts that we've been given, and I dawned on Lisa, my wife, and I that we had a gift of being able to put words to what we were feeling and experiencing as bereaved parents. And it was amazing to us when we did that, how many other people took comfort and could find their way through that darkness because they didn't have the words to say what they were going through. And so us being able to say it for them equipped them to be able to process and handle those things. I think that's a good lesson for all of us, really, is sometimes you have something that somebody else needs, and even though it hurts to share it with them,
Mhm.
it ends up helping you more when you do it. And that's really what we learned um, from our journey, sort of starting to share these things with other people, and that's led to all kinds of blessings for us that have made true that promise in Romans 8:28 about how God will work everything for good to those that love Him. It's not good to lose a son, but it is good to find community among a lot of other hurting people, and find ways to help and be helped by them by your willingness to share what you're going through.
Yeah. And I think that's a great point. Like even as I was reading your book, what struck me about it, I think, is to the fact that you're not afraid to share your faith with your patients and with those around you because I'm not sure as you went through your training, medical training, and they talk about your professionalism, and a lot of times you aren't always supposed to share personal things.
Yeah.
And to me, that I guess I never felt that comfortable always keeping a wall between me and patients. Yes, you have to kind of have some professional distance there, but I feel like I want them to know who I am as a person as well. And so I think, there aren't very many in the medical practices that do step out and share their faith and things about themselves with their patients. And so
Right.
I think patients will appreciate that, to know that you are human. Let's talk about your second book a little bit.
Okay.
Yeah. So tell us what spurred the writing of that, and
Sure.
what that's
So I've seen the interview really as it came out of this problem that I had, that I think I had largely because I'm a Christian who's also a scientist. And when you have a glioblastoma patient, that particular cancer is almost always fatal. It's a 5 year survival rate is basically zero. 10-year survival is zero. Really. I've had one 10-year survivor in my career. So it's just a deadly disease. And so it's one of those things where if you're a Christian and the Bible says God can heal and you're supposed to pray without ceasing, and neuroscience teaches us that, and experience teaches us that people who have hope and who fight and who try and don't give up, they do better. They have fewer infections and they have a higher quality of life, and they don't get divorced and they don't wreck their families and all that. So even if they die, they have a better life if they hold on to hope. And yet at the same time, when I look at that CAT scan or that MRI of a patient and I see that glioblastoma, I would always say to myself, I've seen the end of you. I know exactly what's going to happen to you. I know when it's going to happen. I know what your scan's going to look like. I know what your biopsy results going to be. I know what you're going to feel like. I know when your hair's going to fall out. I could just see that path, because so many patients, they all do the same thing and they die in 15 months, and no matter what we do, right? And so I had this conundrum of, how do I tell a patient to hang on and have faith and hope when I don't have hope for them? And so I was studying that problem and other kinds of bad situations that neurosurgery puts us in with head injuries and all that kind of stuff. And I was trying to figure out how to doctor those people when I couldn't fix them. Right. And so I was studying that, and I was doing research, and I was starting to write the book about how you handle hard things when my son died and I was having my own hard thing. And so then I realized all of that preparation really was was preparing me to learn how to sort of nourish and take our family, my wife and I, our family, through that tragedy. And then the Lord kind of brought it all home by realizing that having experienced major tragedy like that actually made me better at the thing I started in the first place trying to do, which was doctor these people when their situation was kind of hopeless. And we realized that the deadliest disease that humans can encounter is not cancer, it's hopelessness. Like if you lose hope, even if you survive your disease, your life is over. Like you're miserable, or you're never going to be okay again. But if you can find hope, then even while you're dying, you can still be living. Like, none of us get to choose how many days we live, but we can all choose to live them well, right? And so that's what that book is about.
So tell us the name of your podcast.
Well, it's
So
hard to remember. It's the Dr. Lee Warren podcast. It's just my name. So Dr. Lee Warren. And it's on Podbean and Spotify and Apple and everywhere you can find podcasts. And the other thing that I want people to check out is I write a weekly newsletter. It's kind of a subscription, a prescription for how to change your mind and have a better life. And it's my website is wleewarrenmd.com. And so you can get on there and you can find the podcast and my books and all the newsletter and all that kind of stuff too. So
we sure are happy to have you in central Nebraska.
thank you.
Hopefully you felt welcome. I encourage everybody to check out Dr. Warren's podcast, check out his website, and the book is wonderful. I actually have a couple people that I've told them I'm going to give them my book when I was done with it. And so it is highly recommended.
Thank you so much.